This afternoon's case discussion on M. Night Shyamalan's Split. So we're open to suggestions. Where would you like to start? There's no wrong answer here. I apologize. I assure you.
So beginners?
You're flirting with the camera, right?
Huh?
You're
Oh,
on.
it's right there. Oh, I thought it was this way,
it.
and that's why I said, what?
That's
Oh,
fine.
okay.
That's fine, as long as you know.
Well, I can't even participate because I already know where you're going to take it
Then you're
from last semester, so I can't. So you guys go ahead.
I think that the psychiatrist's take is very interesting in Split. That they are like totally different people and can have like different personalities are totally different people and can have like these like
biological differences.
Yeah. I mean that is like clearly more like a personality, like almost like a literary take of like a metaphorical take of like how they're so different, like these personalities are so different. But I thought it very interesting that it seemed like she kind of went against the grain of the scientific community,
Right.
to like fight for her patients in this world.
Mhm.
Right, she was like one of them needs insulin, right?
Yes. Yeah.
And the others aren't diabetic.
And I don't know about the claim about diabetes and insulin, but there are isolated case reports of that general concept published in the literature.
Like allergies. Like there's this one. Yeah, I'm pretty sure there's this one where someone was allergic to a soap and like someone else wasn't. Well, someone else. You know what I mean?
When I was an undergrad, I had a professor who was a psychologist. She had a patient with DID, and like one personality was right-handed and one personality was left-handed.
That's interesting.
Mm-hmm. And we know that previous to at least the diagnosis, the individual was not ambidextrous.
Yeah.
Okay.
Or yeah, the dominant personality.
Yeah. And we probably should look, because I keep on referring to these case reports, we probably should look and get a PDF up on, or in Canvas, so that it supports, we have educational materials that are supportive of this very conversation and discussion. But I mean, it's interesting that you went right to the psychiatrist. I mean, we have two, I think, very compelling characters in this film. And you went to an individual who was neither of the above, right?
Yeah, I think the other characters scare me, and I was like, let's just go with the characters. It's less scary for me to think about.
Well, you know, I think it's interesting, and I've been there too. And Dr. Fletcher is not one of my favoritely portrayed psychiatrists in film.
Yeah.
And
Corrupt.
yeah, and you know, I think that you're onto something, but there's even a layer beyond that which you identified, which may have some support in the medical literature, because she does go against the grain, but there's more to it, isn't there? I mean, what is her medical opinion beyond there being some individual differences between alters?
I think it's that they were more evolved.
Yes. Yeah. And I think that's where her own peer and maybe her mentor is suggesting that she maybe back off a bit. Right? But she doesn't, does she? No. And you know, I'm not sure we're going to end up with a diagnostic label here, but in her not taking the advice of her own mentor, it leads to clinically significant distress and impairment. She dies at the end. But I'm sorry, there's a spoiler.
Well,
We're supposed to watch it.
yeah.
Right?
Yeah.
Is there any behaviors of Dr. Fletcher through the film that made you uncomfortable beyond that may have predicted or provided that risk assessment that she was putting herself at risk? The answer is yes. So let me rephrase the question. What behaviors of Dr. Fletcher earlier in the film seem to suggest and or pose risk of her future demise?
I mean, first of all, she's meeting him at his house, right?
Yeah, that's what
immediate
you-
red flag. You know,
Boundary
knowing
issues.
that almost daily, or so ever so often, going into the space that may or may not be most safe. You know, continuously after receiving several red flags, and then
She goes there.
she goes to the man's house, right?
Oh wait, I don't know about
Is he
before.
coming into the office or?
He's coming to the
Yeah,
office.
Oh,
until
sorry.
the end of the movie.
Sorry.
Yeah.
Well, speaking of the end of the movie, when I think it was Daniel, David, one of the alters was Dennis. Dennis was continuously sending her the emails. You know, that's a major red flag. That screams, you know, obsessive, paranoia, something. And then she went into his house and everything kind of escalated after that. But to me, it kind of is giving me a bit of like a savior complex, you know? There are people that she could have consulted, referenced, you know, she could have, I don't know what state they're in, but she could have done mandatory and voluntary after.
Pennsylvania.
Right, other than Pennsylvania. Do we we have that in Pennsylvania?
Yeah.
I would
Yeah.
assume
It's a
so.
301. No, two.
Five.
It's like a 301. They use the numbers for it over
Yeah.
there too. Well, we do involuntary.
Yeah, but there were several steps that she could have
True.
taken to improve her safety and the safety of the patient
Right.
that she did not follow, and she acted as if she was the only primary caretaker
Yeah.
for this patient.
And that did strike me as somewhat odd. Again, I don't practice in Pennsylvania. I don't have a Pennsylvania license. But she does go to where he resides because she is concerned about his safety. And as such, you would have thought that any clinician would have operated within the context of a treatment team.
Right.
And that would include not only a biopsychosocial treatment team, but when we...
It's good.
Yeah. And you're exactly right. And you're also exactly right on your other assessment in that not only does she go there, which is completely unethical in the way she did, but her bringing him to her place of residence is equally as concerning.
It's perfect for evidence, yeah.
Now, even at the point where Dennis/Kevin meets her at her apartment on multiple occasions, he may not have been at imminent risk, but he was certainly at high risk, right? And we know, and she better than anyone, knows his history. To bring that severe a case into a place, into your safe place, is very concerning and points to significant boundary issues between doctor and patient.
Do you feel like it's that she was trying to use him as some sort of tool to prove this point, this like theory she had?
So you're phrasing it in the form of a question, but as a psychiatrist, you know, I think that you're bringing it up because you feel that way.
Sure.
So,
Yeah, I mean, clearly, like, no one believes what she thinks is going on here, so she has a vested interest in protecting her possible hypothesis.
What's that? The blood for
so that's a concern then. If she's doing this, and doing this fairly early on, at least from our view, earlier in the movie, only to promote her own career, boy, is that unethical too.
Well, it may not reach that way.
You
But we
could-
can
you
still do
could-
the audio from the chairman. Would that work? Do it here?
Yes,
Well,
turn it
so
sideways
you-
and just kind of face it down.
Yeah, we're gonna give you a little bit of a shake up here. So let's see here. We're gonna really give
You
you.
probably have to go on its side.
Yeah, we're gonna go. So everybody close their eyes because you're gonna get seasick very quick.
Other way. Because it's short.
Maybe the back. Yeah, so we'll do one of these
Yeah.
and do that.
So this won't lose you.
Yeah.
I'm gonna tilt it.
Is that good?
Yeah, there's nobody bumps it. It's really fine. What else with Dr. Fletcher?
I guess to make the connection at the very end, when he like doesn't kill that last girl because she has been feeling like abused before, and he says, oh, like we're the evolved ones, or like we're the ones that because you're broken or something, that could be like a connection to what Dr. Fletcher's like point was, and maybe she's like kind of influencing him in some way.
Do they say how long that she's been seeing him for? I can't remember. No.
It's been a while.
Yeah, they say like years.
Yeah.
They said like years plural.
Yeah.
Yeah, so I feel like it's interesting, like like, was she actually, because I know, like, the therapy that they kind of propose now is, like, eventually you have to integrate, so I wonder, like, what actual therapy was she employing, or was she just asking him a lot of questions and not actually treating him? Because there's, like, no, I mean, it's only that, like, she was, I think, obviously, like, he was aware of the different personalities, because, you know, like, they talk about it, but, like,
And there's like recordings of the different ones.
yeah.
Also, if you treat it, then there's the ulterior motive of, like, I want to present this, you know, and then it goes away, right? You lose
Yeah.
some of that data, you know, so I wonder if there's some other hidden motive there.
I really think that's a very important question to get at in this film. Because we're you know, the rest of it attacking, but we're certainly concerned about Dr. Fletcher's ethical behavior as a physician or clinician. And yeah, you're right. If this is all motivated to further her career, what benefit does she get from treating it successfully?
Right.
I think it's a fair question. Yeah. Wow. All right. So, any other thoughts about Dr. Fletcher?
Oh, I also wonder, how, I guess it was, I mean, how controversial, and this is like more of a question, I guess, about how controversial is the diagnosis now? Because I know that movie isn't that old, but like, I feel like they brought it up as like this super controversial thing, and I feel like at least in this facility, it's like a very genuine
I think the
diagnosis.
question is one of quality versus quantity. Qualitatively, I don't think it's a controversial diagnosis at all.
Yeah, because they were kind of acting like it was.
Yeah. No, I don't believe it is. On the other,
Yeah.
on the other hand, quantifiably, there might be some controversy in how often it's diagnosed. Right? I think that's where the discussion, the medical discussion, truly is localized.
And it's contextual, right? There's a lot of cultural and regional context inside of that. You know, what we may call DID, other cultures may call, you know, something else, you know. Especially cultures that can be more spiritual or naturalistic, it might not necessarily use a diagnosis. So that's also worth noting.
And that's a great point, and it's a point that the American Psychiatric Association addressed back in 2013, prior to in the publication of the most recent revision of the DSM, right? Because one of the changes of DID in the actual definition of the DSM-5 is that the individual may experience aspects of possession, which meets diagnosis of DID in some cultures. So your point was actually, I mean, printed in the latest text revision of the DSM, the DSM-5, which also then, and I know I didn't assign this, but when you watch a movie like Split, which is a very concrete, perhaps over-the-top case depiction of this illness called DID, and you watch The Exorcist, 1973, classic, they're the same condition as per the DSM-5, where the alter in the 73 film is Beelzebub, or was it Pazul, really? Or,
Yeah.
Right?
Something like that, yeah.
The Zol.
Yeah. The demon, Satan,
Yeah.
Legion.
Oh, I could see that because she kind of has like the childhood symptoms of like an abuse happening because she like, there's like that, you know, that scene where she's like,
Mm-hmm.
she urinates on the carpet and so, yeah.
Mm-hmm. Different, I mean, incredibly different movies. One's a thriller, one's a horror film. One, I think, a non-clerk would walk out of a theater and say is about the supernatural and Satan. The other movie, again, much more straightforward depiction. But after a conversation like this, we probably reach the same exact diagnosis of dissociative identity disorder, or DID, at least per the DSM-5.
I guess that's a good segue to, like, most, a lot of cases of DID have some child abuse as an origin. So then in this movie, I guess the child abuse would come from his mom, who was OCD.
She appeared to have OCD, obsessive compulsive personality, very controlling, right? Obsessive compulsive personality traits.
Definitely has to be more than that though. Just because like it has to be like very intense, repeated, or repeated, right? Doesn't it have to be repeated trauma? Or is
I've
that not
always
necessarily? Yeah.
Just assumed, you know, with a
For DID?
Yeah.
No, it could be a single trauma.
Oh, really? Oh, that's interesting.
Well, if it's severe enough, or yeah, if an individual dissociates during a trauma, because that trauma is so severe that they breach off one aspect of who they are, so that that state of consciousness can absorb the
that makes
trauma,
sense.
then yeah.
And that's what they were talking about, right? Dennis was the original alter because Dennis emulated the mother. So to survive, he had to, you know, fall into the standard of what the mother needed in terms of cleanliness and like order, and that's how Dennis manifested. But I also wanted to comment, it might be like the volume and intensity of the original trauma. Like his father died in that train accident, and then he went off to live with his abusive mother, like within a very short
that's right.
period of time.
Mhm.
So that could also be a factor.
And what in this movie, and you're right, and what in this movie is inconsistent with that medical opinion? Everything you just said is correct. But there's something in this film that if you spoke to a psychiatrist and or a traumatologist, they would say that the producer then got wrong because he didn't ask you he didn't ask you to review the script prior to going to production.
But he turns into a beast. Well, probably besides that, but like.
I mean, maybe the number of personality in terms of, if that's the etiology is to protect self from that trauma, right, is kind of, you know, is all nice. That doesn't explain the other ones. And maybe just we don't have that information, maybe, but.
And that's likely, right? That's likely.
Yeah.
And but we can expect M. Night Shyamalan, although if he wanted to create a Netflix series explaining all
Right.
30
You can
plus,
prequel
how
it all.
awesome,
Yeah, right.
how awesome would that be?
Yeah.
If anybody's listening out in cyberspace. But there's something else here. A traumatologist would tell you that the age of the youngest alter is the age of the trauma,
And 9 is kind of old.
right? And Hedwig is 9,
Yeah.
which complicates things here.
When did his dad die? Did it ever see him?
Oh, that's a
3 or
good
4.
question.
He was like a toddler, like
Right.
school age.
So that would seem to suggest, if we think that M. Night did not make a mistake, because M. Night doesn't make mistakes, that the father's death was not the trauma that resulted in DID. It certainly could have been traumatic for a child, absolutely, but it wasn't what caused the DID. Something happened at 9, Hedwig's age, right? That's, again, just a small blooper.
I also want to parallel, I forgot what is his name, Kevin, and Anya Taylor-Joy, whatever her character's name is.
Casey?
Yes, Casey. I just want to parallel, you know, both have gone through significant childhood trauma, but you know, how one copes or how the trauma manifests is like completely different. I don't know if that has to do with the age of onset or the severity. We find out, you know, Casey has been abused by her uncle, and she does have maladaptive self-harm, like coping mechanisms. But you know, they find this connection in being abused when they were like younger towards the end of the movie. But again, how they cope, how they adapt is like totally different. And you know, that just goes to show that, you know, trauma, people may share experiences of trauma, but everybody's, you know, adaptation to those experiences are different.
And how's Casey coping? And what's the neurobiology of that? When you say self-harm, what specifically do you mean? She's cutting, right? She's cutting. So how in the world is cutting addressing her underlying problem?
Is it a distractor, like physical pain to distract from emotional pain?
You're exactly right. So let's talk a little bit about what do you mean by emotional pain?
The memories of abuse.
Memories of abuse. What else? What is it that's happening when Casey cuts?
Isn't there like a release of, it's a certain neurotransmitter, right?
Endorphins. Yeah.
Right.
Endorphins, okay.
Right. She's dissociating. Right. And what I think would be fair to assume, reasonable to assume, is that when she was sexually traumatized by her uncle, she dissociated. And that was potentially life-saving. That was a function of her hypothalamus, right? Fight, flight, and freeze. Now, she couldn't fight. She was a baby. She was a child. She couldn't fly. Clearly, she couldn't get away. So the hypothalamic function was that third F, and she froze. She dissociated. And evidence to support that is because in a later age, an adolescent age, she's continuing to dissociate. And what was once life-preserving is now the symptom that suggests an underlying mental disorder. Rule out PTSD. So it's also reasonable to assume that she's not getting proper treatment because her cutting is getting her out of those dissociative episodes. That's maladaptive. And unfortunately, she probably needs an adjustment in her treatment plan.
It's interesting too, because you see almost how she reacts to the situation versus the other, people there, and you can kind of see some of that disassociated, like protection, almost in those, kind of how she's kind of like calm and kind of, not there, like not fully in that kind of fear response. She's more, withdrawn from it, kind of frozen,
Yeah.
Yeah.
Yeah, again, you could look at these three young women's responses to now what is their current trauma. And their hypothalamus is kicking in, right? It's the fear response in 2 of the 3.
Yeah.
Okay. Which is interesting because it also suggests something even further here. And that something further gets at another blooper in this movie. And that is the screen capture when we get a glimpse at Dennis's laptop or his desktop. Anybody take notice of that?
It's like the thumbnails, right? Of
Yeah.
different personalities.
Yeah, different personality, different alters, right? Anybody catch what I'm getting at?
Like who's recording it, or
What do you mean?
why is it on his computer versus like the psychiatrist's computer?
You were kind of talking about it earlier too. If that's what he's gonna, maybe. I'm thinking, maybe not.
Actually, it was posted on my Instagram account yesterday. Screen capture. Again, if you pause this movie and look closely, there's something there that I think would be the focus of clinical discussion. Nobody?
Oh, is it because there's like a hierarchy, kind of like the way he separates the personalities? There's 3 in front, Kevin's in the middle, and then like.
Well, let's talk about what you just said, even before you get to the potential hierarchy, because what did you just identify?
Was it Kevin?
Yeah, what's that about?
Oh, like why is he a personality versus like, just a patient,
Yeah.
like himself.
And if that's the case, if Kevin is an alter, what's the obvious follow-up question,
Who's the
Who's their
real?
real? Is there?
right? And what's the probable answer?
Dennis.
No?
They're also
Come on,
different answers.
Who might be the index case here of someone who was
Oh, I
sexually
remember
traumatized?
it, yeah.
Huh? No?
I feel like I remember
Really?
you talking about this.
Huh? No?
I feel like I remember what you were going to say.
Wait, are we trying to select which one of his personalities is the main?
My question is, who is the patient in M. Night Shyamalan's Split?
I remember. Well, I actually.
No?
Dude, what's what?
I mean, Kevin is like the main, but Barry is the one who always goes in for appointments.
Who is the person with sexual trauma that is at risk for developing DID? Yeah.
Yeah, I remember you talking about that.
This meaning the actual plot, what we've seen, might all be a product of the patient's mind. Right? Which gets at your point and what you observed in that, well, there's one person here that is incredibly calm under pressure.
Yeah.
And it might be because this is all part of her mind.
Wow.
So let's talk a little bit about dissociation. Right. The first dissociative disorder beyond that which is due to a medical condition or the effects of a substance is depersonalization, derealization disorder. Right? So that's the first one I want you to be able to identify in a shelf exam. This condition is clinically significant, as all mental disorders are, and would be hallmarked either, it could be both, but it could be either some subjective sense of being disconnected from oneself or others, and again, the best example of other would be one's environment. If it's oneself, we call that aspect depersonalization. The condition is depersonalization, derealization disorder. If it's the environment, we refer to that aspect as derealization, but the single best answer is still depersonalization, derealization disorder. If an individual has aspects of either or both and gaps in memory that cannot be explained by ordinary forgetfulness, we call that dissociative amnesia. You do not render two diagnoses. If a patient presents to you with depersonalization and derealization and gaps in memory, single best answer, dissociative amnesia. If a person is sitting in your office for which you are entertaining dissociative amnesia as a single best answer, what question do you now want to ask them? In terms of reading this in a clinical vignette on a shelf exam, what do you want to know next to get at the right answer?
Try to rule out other causes, so start with, I guess, I don't know, substance use.
We always do, okay? Let's say that that's been, as well as a medical condition, investigated and ruled out.
Wouldn't it be like a timeline?
More specific.
If there's any stimulus that causes a dissociation episode.
How long have you been having these amnesic episodes?
All important questions, but to get your single best answer on a shelf, what do you need to know?
Have they ever had episodes where they're like found somewhere else and they don't know how they got there?
What are you getting at?
Dissociative
Fugue.
That's it. Right? Because you want to differentiate choice A, dissociative amnesia, from choice B, dissociative amnesia with fugue. Because the fugue state is a specifier. Right? So you're going to have to know that. That's right. Whether or not the individual endorses a fugue state, if they also communicate to you that there are discrete episodes where another state of consciousness overtakes their conscious awareness, that is, there's an altered state that takes over the conscious awareness, you're getting at DID. So if a person presents with depersonalization and derealization and forgetfulness and some seemingly purposeful movement or travel away from their home and a distinct personality state, single best answer is DID. So there's some hierarchy here that you have to make sure you understand going into your shelf exam. And that's where we end up with Casey. And even Kevin Crum, if he even exists. Questions about the hierarchy, the differential diagnosis of the dissociative disorders?
What are some of the questions that you asked to get at fugue?
Exactly what you just said, right? Anything getting at some seemingly purposeful travel.
Okay.
Have you ever blanked out and come to in a different part of town, etc.? Mm-hmm. Other observations in this film? And we've talked about the different classes of medications that might result in or induce a dissociative state because they're the same that induce psychosis. Might there be any evidence of either of those five in this movie?
Well, I guess there's a layer is like under a zoo. So don't they use like ketamine to
Yeah, they do.
tranquilize animals?
Yeah, they do. Yeah, I just think that's an
Oh.
irony. It's
Can you come
a
up
nice
with-
irony. Mhm. And that's exactly what I was getting at, so I have no further input there. So.
Yeah. I was gonna say, I'm like, oh, that was the big reveal.
It really is. I mean,
That was the big reveal.
I don't see alcohol playing a major role in this film, or inhalants, or cannabis, or stimulants, but hallucinogens, specifically ketamine. So there are 3 subclasses of hallucinogens. Ketamine being an example of a dissociative, hence dissociative identity disorder. What are the other 2 subclasses? And give me examples of each. So we got the dissociatives, but there's 2 others.
Hallucinogens? Is that what we're?
Subclasses of hallucinogens, yes. Psychedelics? Anybody have any example of psychedelics?
LSD.
Well, everybody just jumped out. LSD, psilocybin. Really no evidence of that or use of that here. Although, again, we should have a high clinical index of suspicion nonetheless. And then the 3rd and final subclass are the deliriants. So those substances that have significant antihistaminic or anticholinergic effects. Again, not really prevalent in this movie per se.
This might be slightly off tangent, but so like for ketamine, you know, there's a lot of like research coming out of Canada how it's like being used for like treatment-resistant depression or PTSD. If it's a dissociative hallucinogen, like how do you think, like how does that like mechanism like work? Like how do you think it works for treatment-resistant depression or even like postpartum in some people? Like what's the association there?
Yeah, and I don't think we have a real answer here.
Okay.
Okay. Ketamine has been FDA approved in the U.S. for the use of. Oh yeah, for treatment-resistant depression. Right, absolutely. The mechanism of action of which has not been completely teased out.
Yeah.
But it does look to be mediated through glutamate.
Okay. And that's at like smaller doses than like, you know, tranquilizing ketamine.
Mhm.
Obviously. Okay.
It's actually esketamine is the one that they approved here, which is just their way of making money off of it. It's probably the best way to think about that. But, we also have a new console for Ren, but when we're done, we'll just.
You bring up an interesting point, because if this were all substance-induced, perhaps due to ketamine, if we're identifying Casey Cook as the index case, I don't think anyone would have that big of a problem thinking that someone, maybe even a Dr. Fletcher, would have diagnosed Casey with treatment-resistant depression. I mean, she is at extremely high risk for depression, and I don't know if we would be all that surprised if she did not respond to the first 2 or 3 prescribed antidepressants. So might she have received ketamine, and as a reaction to that, might we see what happens in split, right, as a dissociative? There's another potential here, and it's still an example of a hallucinogen-induced dissociative episode or psychotic episode outside of the ketamine class, outside of the dissociative class. What other?
Inhalant?
No, still hallucinogen based,
I just have a
but
question.
not a
quick-
dissociative hallucinogen.
I just have a quick question. Oh, sorry.
Good.
Oh no, I was gonna ask, when would you consider some depression treatment resistant? Is there a certain like amount of attempted medications or something, or is it time?
Yeah. So for treatment-resistant depression, you're talking about 2 established failed trials of antidepressants. Failed trial is no less than 12 weeks, and no less than 2 weeks at the maximum dose.
Okay.
So if you have 3 failed trials and you've gotten fluoxetine 20 for 3 weeks, if you've gotten paroxetine 20 for 8 weeks, and you come to me, there's no way I'm saying you have a single failed trial, much less 2.
Right.
Okay? So it's going to be 12 weeks, the last 2 of which are at the maximum available dose. Outside of the dissociative class of hallucinogens, might there be more evidence or additional evidence of hallucinogen-induced dissociative disorder in split? And I'll give you a hint, it has nothing to do with the deliriums. What's the only other subclass? Psychedelics. Is there any link here? Why in the world would a psychedelic be introduced to Casey?
I don't think her age.
To treat PTSD.
Yeah.
Oh, you mean, oh, okay.
Yeah, there's emerging evidence that psychedelics like psilocybin are effective in treating post-traumatic stress disorder. And is anyone here really surprised that she might carry that diagnosis? Okay, so that's another consideration here.
I also wanted to just ask a question about like the biological differences between the different alters and DID. One of the alters like had diabetes. Obviously, you know, the fictionalized supernatural version had like super strength, but like Hedwig was childlike strength. You know, then when they switched to Dennis, stronger strength, you know, was able to break down the door. So is that another fictionalized Hollywood thing, or do we actually see biological differences, like trackable biological differences, like whether through MRI or, you know, BMPs or whatever, in different alters in the body?
So the simple answer is yes. However, not nearly to the extent portrayed in this movie.
Right, right.
When I saw The Beast, I instantly thought of ketamine or PCP.
Mm-hmm.
So I'm not getting away from that being drug induced. Now the biomarkers changing with different alters, there is some evidence that is in the literature, and we're going to find that for you. He's going to find it for you. Right? We're going to post that on campus for you.
Okay.
Right? But not nearly to the extent as portrayed in this film.
Yeah, yeah. Okay.
So in a way, you know, M. Night comes up with this drama, this over-sensationalized depiction, which gets us to talk about it. And in our discussion, we're gonna keep it scientific, and that's perfectly fine.
Yeah.
Right? We can
Yeah.
definitely use his film to talk about the evidence-based literature. Any other observations in Split? Take that as a no. All right, we'll leave it here. We'll take a brief break, and then we'll come right back with our case conference. Thank you.
Oh, what about